Thanks for joining us today here on Enforce. Today we have a special guest that we're going to interview. Her name is Meredith Petrie. How are you doing today, Meredith?
Good, thanks. How are you?
I'm doing well. So you have some information for us today, and it's regarding a report that you have written, some information to get out to the general public that I think is valuable, and I wanted to share with the audience here today. It's completely free information. And you went really deep with it, and I think we'll just share some of it on video, give the audience an idea of what it's about, and they can go ahead and download it on their own. We'll have something in the show notes here for you. Find the link, and you can go and download this report yourselves. But so the report is how to save thousands in medical expenses while improving the quality of your care. Now that sounds interesting. I mean, I have medical bills myself, and after reading this report, I'm kicking myself because I can see how if I would have just asked the right questions, made a few phone calls, I wouldn't be in this mess. And I know lots of other people too that same thing.
A whole lot, absolutely.
So what motivated you to write something like this? I mean, I'm glad you did, but why?
Well, I've had a lot of personal experience in this arena here. I had a lot of personal experience myself when it came to having doctor's visits and having a lot of testing ordered, a lot of diagnostics, MRIs, CT scans, X-rays, and
For yourself?
For myself.
Oh my goodness.
And what I learned about that was that, I actually was kind of in the blind there for a long time, and since I work in the healthcare industry, I started kind of listening over my ear to the insurance conversations that were happening behind me, and I started kind of catching on to the things that patients were extremely upset about, the things that were shocking to them that they weren't familiar with, and so I started paying attention to some of these very basic words that I could learn to understand what this insurance jargon meant, or kind of understand the process.
You're working at the sleep center, and you're just overhearing conversations basically in the office from patients and everybody else.
Absolutely. Insurance department's phone calls, listening to what the insurance department asked during the phone calls, deductible or not, covered service or not, co-insurance, co-pays. And, at the same time, I was going through a lot of testing myself personally. And so I started making phone calls and kind of asking around, and I started learning how to do this. Times have changed. Times are definitely different now. There's a lot of changes when it comes to healthcare coverage, a lot of terminology that people think, they just trust what's there. They trust that their doctors and the facilities they're going to would never kind of put them in a bad situation, that they're to help them. But a lot of people make a lot of mistakes, or not necessarily mistakes, but could have saved a lot of money if they would have made a little educated decisions.
Yeah, had they just known a little bit more, the things that you explained here. I mean, I wish I would have known those things as well.
Absolutely.
And you go over a story in there about yourself. I don't know if this is the first time you saved money or just one of the examples that you brought out. Why don't you share that with everyone?
One example, which was a huge example, was kind of my first big lesson learned, or if I hadn't made that phone call, I would have been out about $2,000 out of pocket for something that I was actually out zero out of pocket for ultimately at the end. I saw my doctor. I was scheduled for an MRI. He went ahead and made an appointment at the facility that he's used to using and familiar with. He gave me an appointment card, and it said to go, to the hospital and get this MRI done, and then he would, I'd follow back up with him. And so,
sounds easy enough.
Sure, and of course, there's no harm in that. I did know that there were other places to have MRIs, but I thought that he wanted his at the hospital, so I figured, okay, let's go to the hospital. So when I called the hospital and I asked them, from learning all the things I'm hearing in the background from the insurance department, I called them and said, okay, so I need to have an MRI there. Can you explain to me whether this hits my deductible or not? Whether this is a covered service? Absolutely was the first question. Does my insurance cover this? They said yes. Does it hit my deductible? They said yes. They said after deductibles hit, which was for me was $1,500. After deductible, then my insurance
paid. Your deductible was $1,500.
My deductible was $1,500, and I had nothing done that year so far. So I was going to have to meet my deductible, which is $1,500, meaning I have to pay $1,500 out of my pocket, and then insurance would start up and pay the rest, or their percentage of the rest. So insurance would pay 80% after I paid my deductible, and I would pay 20% after I paid my deductible. So $1,500 in, just for deductible, because it's the first
which you would
thing
pay
of the year.
no
That's regardless.
where.
You're going to have deductibles most of the time.
Right.
So $1,500 for my deductible. The 20% of the procedure ended up being a couple $100, and then I also had a copay, which was a $50 specialist copay. And so, I added that up, and it was going to be about $2,000 for me to have this MRI at the hospital. And I said, okay, that's a lot. And, I was ready to go get this MRI done really quickly, because whenever you're sent for a test, doctors don't make the habit of wasting tests and wasting your time and money. It was a very important test, and I could not wait to go get it done to see what was happening. And after I called the hospital and found out that, I said, well, I can't have this MRI as quick as I thought I could, so let me call around. And so that's my first experience of realizing, okay, maybe there's a cheaper option. And
So what happened when you called somebody else?
It really opened my eyes, and from this point forward, I will never make mistakes that I have in the past again. I immediately called outside diagnostic facilities that can do MRIs. And the first place I called, they said, okay, it does not hit your deductible. There's no co-insurance. It's covered at 100%, no deductible involved, and no copay. So I literally went from extreme terror of how am I going to spend $2,000 or how am I going to pay this $2,000 bill?
Right.
I need this MRI. It's extremely important. You're already missing time from work, money, all kind of other costs come into play as well. But I was going to spend $2,000 at the hospital MRI, and I ended up spending $0 in the next day appointment at the diagnostic facility. Now, all facilities are not different. I mean, it doesn't just mean, okay, don't go to hospitals or don't go to this. It means you can look around and you will be amazed at how the difference is money out of your pocket, literally thousands of dollars, just for making a phone call and finding out what else is out there. Now, these MRIs were technically almost read by the same people. I mean, it's a quality facility. I'm not saying to go to lower type of facility. It's really just
same standards,
same physicians, same standards, same equipment, same people reading it. So, that really, really kind of sparked in me, wow, people lose their homes over $1,000 bills.
Yeah.
I mean, MRI is something small, but if you think about larger procedures, actually medical procedures that need to get done, it just terrifies me to hear people just trust what they're told, go where they're told, never call and ask, never even find out if it's a covered test.
Yeah. So you would have spent this $2,000 out of pocket, plus everything that your insurance was going to pay. And you ended up paying nothing at all, just from knowing what to do, being able to ask the right questions.
That's the key word, asking the right questions. That's the big thing, is knowing what to ask.
So this is what you want people to know.
100%. Absolutely. Okay. Absolutely. I have another example of just the covered test portion. I have a patient who, not a patient, but there was somebody that I came across that actually needed help because they kind of ended up in a bad situation from medical bills.
That's just from working at the sleep
This is from working at the sleep facility that I run, and the patient came in from an ad we had put in to screen for sleep issues. And she came in and said that she had, her doctor years ago asked her, said, you're having weight issues, you're having blood pressure issues, you need to have a sleep study done. So her doctor scheduled her for the sleep study at the hospital, and the sleep study, when she called the office, and they said, yes, if your insurance doesn't cover all the way, we'll work with you. And they were in no way trying to set her up for failure, but what ended up being is that this woman didn't take the time to call her insurance and ask if this type of procedure, the sleep study, was a covered service. And so since she did not hear it for herself and, put her fate and her financial fate into somebody else's hands a little bit, if you look at it from my point of view.
Because they'll let you just come in and get it done.
They had the sleep study, and she had the first night to diagnose and the second night to treat. And then she was, a couple months later, found out her insurance did not cover any type of testing. She was billed $10,000 total, $5,000 for one study and $5,000 for another study. And this is a small business owner, local small business owner, that could have easily lost her business due to, again, nothing that anybody did, criminally to her, but just choices that she did not know to look for.
She didn't know the questions. She didn't know what to ask.
100%. So I constantly try to make sure people, start asking questions. Don't just, it's not offensive. Most physicians are going to be happy to say, and a lot of physicians now you're hearing them say, go look for your options, and then I'll send the order wherever you'd like to go. So a lot of doctors, there's responsibility on the doctor's part too, that, they should be helping you to say, okay, well, you don't have to go to this place here. You can go wherever you'd like to go. But a lot of times the doctors are familiar with the facility. They like the quality of their work, and they're going to send you there. But I've never met a doctor, and since I've had that first experience where I saved $2,000, I've never had a doctor say to me, "Oh, well, I'm offended that you want a price check." They say that's absolutely fine. You find where you'd like to go, and we'll send the order. So there was no issue there.
So people just need to know that they
absolutely
can choose. They have options.
100%.
Whether their doctor has a suggestion or not is kind of beside the point. But they have options.
And she spent so much money on the diagnostic and treatment portion of her disease that she didn't actually have the money to afford the treatment for the disease after she spent $10,000 to get diagnosed and optimally treated. So she couldn't even afford the equipment that came along with this diagnosis and treatment because of the fact that all the money went into the test itself. Now, another example, which again, it's not about one place versus another. It's about knowing your options. I don't recommend calling 2 places. I recommend calling 4 to 6. You just don't know. There could be something as simple as, there are 2 offices right across the street from each other that do MRIs. It really just comes down to this word, the allowable, which I go to in the report a lot. This kind of magic number that is the number that your 20% comes out of, the insurance is 80% comes out of. That allowable number is the ticket to all what I'm talking about right now when it comes to insurance.
The allowable that you're saying, that's the amount of money.
For example, if I have a sleep study done and my insurance is Blue Cross Blue Shield, then it's, this is just a random example, but Blue Cross might pay them, $3,000 for this test. And then that $3,000 number can be different at a hospital or different at a private lab. So these numbers are actually, again, different from place to place, but they can have thousands of dollars in differences in the pricing. Again, even in 2 private facilities, you could have that much of a difference.
Same insurance, same test.
Same insurance, same test,
allowable.
Same doctor reading it, different allowable. So your percentage comes out of this big magic number, the allowable. And that number, again, you would not believe the differences in locations. I mean, there can be, again, like the sleep studies, for example, some places get the allowable $5,000. Our allowable is $1,300. So my patients that have 20% co-insurance, their 20% is coming out of $1,300, not 20% out of $5,000. 20% of $1,300 is around $250, and 20% of $5,000 is $1,000. So you're talking about $750 difference just in your 20% co-insurance. If you look at where you're at, ask the right questions to their office before you go in.
So now you're really talking about, in your first example that you gave, where you knew this person and she was ultimately denied coverage,
right?
Not knowing going into it because she didn't know the right question. Mm-hmm. Ultimately denied. But there are other cases where it'll still be covered, but depending on your insurance and what you have, you may be responsible for a certain percentage of that coverage. Maybe your insurance can pay 80, you can pay 20, for example.
70-30, 80-20, usually switch funds.
So as long as you know that allowable number, you can apply your percentage to that and know how much you're going to have to pay. So I mean, I'd rather pay 20% of the lower cost than 20% of the higher cost.
Absolutely. And as long as they're regulated, standardized types of testings that, are credentialed and accredited and physicians over the practices, they're the same quality, the same level equipment. I mean, you're literally looking at the same machines a lot of times. That number, again, is saving you money. But another big point to this and a big picture of this is that you're saving money for yourself, but you're also saving money for your insurance company. A lot of people aren't really worried about saving insurance company money. They say, hey, we pay money. But the point is
I know for a fact that they have a lot of money.
They have a lot of your money and mine too, and a lot of our viewers as well. But the point is that the more you cost them, the more you're going to pay in the following years. I mean, it's you want in a big picture to save your insurance money when you can, because it's going to turn right back around on you. You will have your rates can go up higher. I mean, the more they have to spend and the more they have to take care of sick people, the more they're going to charge you the following year for that. So it's going to come back to you also from what you're making your insurance pay.
And you and I are both in the healthcare industry, and it's just a fact that unnecessary high costs like this are just driving up the cost of everything.
Absolutely.
So
everybody's premiums.
Everybody in the United States is going to end up paying more for their insurance premiums, more for their procedures. It's just making a big mess. So there's an element of saving your own money, and there's an element of sort of a social responsibility.
Absolutely.
Sounds like.
Absolutely, 100%. And again, most people wouldn't know to think about that. So that's why we want to constantly be, sharing our knowledge, educating as many people as you can to understand this. I mean, I hate seeing people make these mistakes now that I know that it's literally, I mean, it's your summer vacation gone. The money, it's just it's so important. Your time, your money, we're living in a different time now, and there's no room for excess. And save the money for yourself, save the money for insurance company. It's always going to come back to you.
So is this report here, how to save thousands in medical expenses while improving the quality of your care, is it just about tests?
Well, my huge spotlight on testing is because of my direct, interaction with that process. It absolutely does not just come down to testing where you can save thousands, while improving the care. There are a lot of other examples. Medications is a huge example. Medicare patients with a donut hole. Medication cost, ER versus urgent care. There's a place where people can save thousands of dollars as well again in the ER versus urgent care setup. It is absolutely, there are companies do have lifetime maximums for you. So, the more you save them on medicines, follow-ups, procedures, testing, office visits, everything that you can do there is going to help when it comes to the lifetime amount of money they're willing to spend on a Medicare patient, for example. So, there's a lot more to it than just testing and MRIs and CT scans and x-rays. That's just kind of my easiest set of examples. But, it goes much further than that. And there's a lot of educated choices you can make that, again, is going to save yourself and your insurance thousands and thousands of dollars a year. Absolutely.
So even the insurance companies should be happy that you're putting this information out
absolutely.
there.
I mean, absolutely.
You're saving them money too.
Yeah, absolutely. I mean, you're right. It does affect the whole country. It affects a lot more than just your own pocketbook. So, we want people to be educated. We want to be informed. In the report, you'll get some pretty good examples of the very simple, 6 to 8 topics that can that I've explained about 4 of them to give definitions of words like allowable and co-insurance and covered testing, and then also the steps to ask once you call and want to compare these types of facilities yourself. So you can compare the facilities like ER versus urgent care. You can compare facilities on medications. I mean, this goes across the board for healthcare.
I like how, it's not a bunch of medical speak in this report. Because you can find some of this information online if you went around and you pieced it together, but you've put it all into one place, and I think you put it in language that we can all read and understand. This is how we talk.
Right, absolutely. It's nothing over anybody's head. I mean, if I can understand this and have so clear a picture of the ways to make the best financial decisions and to keep my money in my wallet. It's so clear and it's so simple. It's not complicated at all. You just have to kind of know some of these definitions and then, get involved, ask questions, go on forums, start this conversation, where help your neighbors or those elderly people on your street that you can help it. This money's going to save, this information is going to save everybody money.
Well, thank you so much for joining us today here. We are going to leave you with those thoughts and just direct you to go ahead and find the link wherever it is in the description of this video. And you'll be able to download this report written by Meredith Petrie here with us today called How to Save Thousands in Medical Expenses While Improving the Quality of Your Care. I hope you'll find it as useful as I did. And thanks again, Meredith, for coming in. It was a pleasure to be speaking with you.
Thank you so much, Chris.
May the force be with you.
Mm-hmm.